Greetings, my name is GIL-FORERO. I am a dentist, magister in higher education, PhD in public health, and full professor at Universidad Santiago de Cali. I am pleased to present the result of this study entitled Knowledge, Attitudes, and Practices of Patients in a Public Health Network's Diabetes Program, a qualitative study from a humanizing, innovative, and inclusive approach conducted in Cali, Colombia. Diabetes represents a local, regional, and global public health problem and remains one of the leading causes of morbidity and mortality among adults between 30 and 70 years of age. Beyond clinical management, diabetes requires continuous health education, patient engagement, and adherence to care programs, particularly within primary healthcare networks. Then, as we know, health education is a central pillar for improving adherence to chronic disease programs. However, traditional educational strategies often fail to consider patient knowledge, attitudes, practices, and lived experiences. That's why the objective of this work is to analyze and develop a health education strategy aimed at promoting adherence to diabetes program using the humanizing, innovative, and inclusive approach adapted to patients' specific knowledge, attitudes, and practices. This study is part of a qualitative research project conducted between 2020 and 2024 within the Northern Health Network ESE in Cali. Data were collected through participatory and qualitative techniques, allowing an in-depth understanding of patient experiences and perception regarding diabetes education and care. Participants emphasized that learning about the disease itself was more important to them, as medical consultations often focus on prescribing medication without providing sufficient explanation about diabetes. Although quantitative data provide essential indicators, this research demonstrates the relevance of qualitative and ethnographic approaches to understand how patients behave, how they interpret their condition, and the reasons behind their practices. Health education supported by current technological tools proved to be more effective than medication and clinical monitoring alone, as it enabled patients to better understand self-care processes, an outcome that was clearly evidenced in the findings of this study. The results highlight the importance of participatory construction tools, as well as the growing role of technology and artificial intelligence used both by patients and healthcare professionals. These tools were identified as facilitators for health education, communication, and long-term adherence to diabetes programs. Our finding suggests that technology, when applied ethically and inclusively, does not replace human care, but rather strengthens humanizations in health education. It enhances patients' autonomy, promotes engagement, and supports more personalized and meaningful learning processes within primary healthcare. Another thing to emphasize is that this research has been published at Data and Frontiers magazines. In conclusion of this research, humanized and innovative educational strategies supported by technology significantly contribute to improving adherence to diabetes care programs. Integrating patient knowledge, attitudes, and practices is essential for strengthening public health interventions and advancing inclusive people-centered care models. So, thank you very much for your attention.